tell us this. I mean, if a World Health emergency is declared, what does that actually mean? What are the implications?
Yeah, it's a good question. So one of the tools that the World Health Organization has is what's called the International Health Regulations. And these are a set of regulations that were approved by all the member states of WHO in 2005. This allows the Director General of the World Health Organization, if he or she at the moment, considers that there is a potential global health emergency, that he can convene an emergency committee. And that emergency committee then gets all of the most up-to-date data from every perspective on what the threat might be. And then, depending on what they think the level of threat is, they can declare this thing called a public health emergency of international concern.
Yes.
And they'll do that if they think that this is an extraordinary event, that there's risk of international spread, and that international collaboration will assist in containing whatever the problem is. So that's what the public health emergency means. But what it also means, if what's called a FAIC, that's a terrible name, but that's how you pronounce this abbreviation, PHEIC. If that is declared, then the WHO can also then list a list of what are called temporary recommendations. And in the case of monkeypox, they can say, for example, attention needs to be paid to access to vaccines, attention needs to be paid to getting the message out to vulnerable communities about what the symptoms are, to healthcare workers, et cetera, et cetera. Those are called temporary recommendations. And because all of the member states of WHO have signed up, they will then take very, very strong notes and hopefully implement those temporary recommendations.
News.
Experts.
Analysis.
Where things stand.
What you need to know. Drive home with John Perlman
On 702.